Good morning students. Today we are going to discuss about acid base disorders. We already discussed about what are the acids, what are the bases and mechanism of regulation of pH. Today we are discussing about acid base disorders. Acid base balance depends on the ratio of bicarbonate and or carbonic acid, which is the constant ratio is 20:1 at physiological pH. Any alteration produced in the ratio between carbonic acid and bicarbonate, its result in acid base imbalance and leads to acidosis or alkalosis. What is acidosis means? It defined as abnormal condition caused by the accumulation of excess acids in the body or by the loss of alkali from the body. That is called acids, and alkalosis is abnormal conditions caused by the accumulation of excess alkali in the body or loss of acids from the body. So this is the acids and acidosis and alkalosis. Next, coming to the acid base imbalance types, acidosis and alkalosis. Under the acidosis, respiratory acidosis and metabolic acidosis. In respiratory acidosis, increase in partial carbon dioxide or bicarbonate. Metabolic acidosis means decrease in bicarbonate. Alkalosis are two types, respiratory alkalosis and metabolic alkalosis. In respiratory alkalosis, decrease partial carbon dioxide. Metabolic acidosis, increase in bicarbonate ions. These are the types of disorder, acids and alkalosis. Acids, respiratory acidosis, metabolic acidosis. Alkalosis, respiratory alkalosis and metabolic alkalosis. Next, coming to the metabolic acidosis. Metabolic acidosis means decreased blood pH due to decreased in bicarbonate levels of plasma is called as metabolic acidosis. Primary change is decrease in bicarbonate levels, that is the primary change, decrease in bicarbonate levels. Next, causes of metabolic acidosis. It's caused due to diabetic mellitus or ketosis. In diabetic mellitus, decreased in bicarbonate levels may be due to increased production of acids. In uncontrolled diabetes and starvation, there is a excess production of acetoacetic acids and beta hydroxybutyric acid. These acids are buffered by utilizing the base component of bicarbonate levels. The concentration of bicarbonate levels are decreased to increase the bicarbonate deficient and result in metabolic acidosis or ketoacidosis. Next one is lactic acidosis. In lactic acidosis, increased production of lactic acid occurs in different exercises. Next one is renal failure. In renal failure, kidney may not be able to excrete the acids in sufficient amounts, that leads to retention of acids in the body. In diarrhea, next one is renal tubular acidosis due to loss of bicarbonate ions. These are the causes of metabolic acidosis. Metabolic acidosis means decreased bicarbonate levels of plasma. Then primary change is decreased bicarbonate levels. Then causes of metabolic acidosis is diabetes mellitus or ketoacidosis, lactic acidosis, renal failure, diarrhea, renal tubular acidosis due to loss of bicarbonate ions. Next is the compensatory mechanism. Metabolic acidosis is compensated by respiratory compensation occurs due to increased pulmonary respiration. This results in removal of carbon dioxide from the body fluids. Increased excretion of H plus ions as ammonium ions and increased excretion of acid, that is dihydrogen phosphate, in urine. These are the compensatory mechanism for metabolic acidosis. Next is the metabolic alkalosis. Metabolic alkalosis defined as increased in blood pH due to increase in bicarbonate levels of plasma is called as metabolic alkalosis. What are the causes for metabolic alkalosis are loss of H plus ions in gastric fluid due to vomiting, loss of gastric juice along with H plus ions in prolonged and severe vomiting, and therapeutic administration of large dose of alkali and injection of abnormal alkali such as disodium carbonate. Then hypokalemia. Hypokalemia means decreased potassium levels. In hypokalemia, when potassium levels is depleted, more H plus ions are exchanged for sodium. So the urine becomes more acidic and the body fluids are more alkali. This result to alkalosis, that is the hypokalemia. And these are the causes of metabolic alkalosis. First one is loss of H plus ions in gastric fluid due to vomiting and injection of abnormal alkali such as disodium carbonate and hypokalemia. Compensatory mechanism is metabolic alkalosis is compensated by increased excretion of alkali, that is bicarbonate, by the kidneys, and diminished formation of ammonia, and respiration is depressed to conserve the carbon dioxide. These are the compensatory mechanisms for metabolic alkalosis. See here, in blood gas H plus ions are increases or decreases. If H plus ions are increases due to alkaloacidosis, this acidosis pH is decreased and bicarbonate also decreased, that is called metabolic acidosis. If H plus ions are decreased, pH is increased and bicarbonate levels are increased, that is called as metabolic alkalosis. Next is coming to the anion gap. What is anion gap means difference between total concentration of measured cations and that of measured anions. Cations are sodium and potassium, anions are chloride and bicarbonate. The total concentration of cations and anions is equal to maintain the neutrality in the body fluids. Sodium and potassium constant is about 95% of plasma cation and 80% of chloride and bicarbonate. The remaining 20% of plasma anions include proteins, phosphate, sulfate, urates and organic acids. What is anion gap means the difference between the total concentration of anions and to concentration of measured cations or anions. See, anion gap represents the unmeasured anions. Anion gap represents the unmeasured anions in the plasma. That means cation minus anion. Normal range of anion gap is 8 to 16 milliequivalents per liter. For example, anion gap, cation minus anion. Cations are sodium and potassium, and anions are bicarbonate plus chlorides. For example, sodium ions is 42 plus potassium level is 4 minus 27 is bicarbonate level plus chloride ions is 103. Total 146 minus 130. The anion gap is 16 milliequivalents per liter. This is the normal range of anion. Next is, what are the causes for anion gap? Normal anion gap, increased anion gap, and decreased anion gap. Normal anion gap is in diarrhea, renal tubular acidosis, carbonic anhydrase inhibitors, and use of drugs like antacids containing magnesium, chloropromide, iodide, and lithium. These are the normal anion gap causes. And increased anion gap causes renal failure, lactic acidosis, metabolic diabetic ketoacidosis, hypokalemia, decreased potassium levels, decreased calcium levels, and decreased magnesium, amino acidureas, organic acidureas, methanol poisoning. In these conditions, increased anion gap is increased, and decreased anion gap is decreased albumin levels, that is called hypoalbuminemia, hypercalcemia, hypermagnesemia, and hyperkalemia. These are the increased, decreased, and normal anion gap causes. Next, coming to the respiratory acidosis. Respiratory acidosis means increase in partial carbon dioxide concentration due to impaired alveolar ventilation. Respiratory center is inhibited, causing irregular breathing and result in carbon dioxide is retention in the body. So, causes of respiratory acidosis is airway obstruction and neuromuscular disorders and disease of the central nervous system. In obstruction to respiratory, this may occur in pneumonia, emphysema, asthma, etc., and cardiac arrest due to severe hypoxia, weakness of respiratory muscles seen in poliomyelitis and myopathies. Then administration of respiratory depressant toxic drugs are morphine depresses the respiratory center. Morphine drug depresses the respiratory center. These are the causes for respiratory acidosis. First one is airway obstruction, chronic obstructive airway diseases, and cardiac arrest, weakness of respiratory muscles, and some toxic drugs, that is morphine. This depresses the respiratory center. Next, coming to the compensatory mechanisms. Respiratory acidosis is compensated by increased renal reabsorption of bicarbonate and increase in urinary acids, that is dihydrogen phosphate and ammonia, Then stimulation of respiratory center by carbon dioxide except in depression type. These are the compensatory mechanisms for respiratory acidosis. The next one is respiratory alkalosis. Respiratory alkalosis means increase in blood pH due to decrease the concentration of carbon dioxide or carbonic acid due to hyperventilation. That is called respiratory alkalosis. Then causes of respiratory alkalosis are high altitude, hyperventilation, fever, pulmonary edema, congestive cardiac failure, septicemia and meningitis. These are the causes for respiratory alkalosis. Then respiratory alkalosis compensated by reduction of urinary ammonia formation and increased excretion of bicarbonate. You can see here, if H plus ions are increased, decrease the blood pH and partial carbon dioxide is increased. This leads to respiratory acidosis. Then H plus ions are decreased, decrease the blood pH levels and decrease the partial carbon dioxide. This leads to respiratory alkalosis. Next, coming to the normal references values. Normal range, pH normal range is 7.35 to 7.45. Partial oxygen is 83 to 108 mmHg. Partial carbon dioxide is 35 to 48 mmHg. Bicarbonate is 22 to 26 millimoles per liter. And sodium is 135 to 145 milliequivalents per liter. Potassium normal range is 3.5 to 5.0 milliequivalents per liter. Chloride ions is 118 to 132 milliequivalents per liter. These are the normal range for pH, partial oxygen, partial carbon dioxide, bicarbonate and electrolytes, sodium, potassium and chloride. Next, coming to the blood gas analysis by using ABG analyzer. First, ABG analysis is an essential part of diagnosis and managing the patient's oxygenation status and acid-base balance. Disorders of acid-base balance can create complications in many disease states, and occasionally the abnormality may be severe. It has to come life-threatening risk factor, means danger risk factor, and it is used to test effectiveness of ventilation. What are the indications for ABG? To assess the ventilatory status, oxygenation and acid base status, to assess the response to intervention and to regulate the electrolyte therapy, to establish the pre-operative baseline parameters, and to assess the sudden dyspnea, cyanosis, abnormal breath sounds, to assess the sudden or unexplained tachypnea, and to assess the diffuse infiltrates in chest X-ray. These are the indications for ABG. And contraindications of arterial blood gas: negative result of Allen's test and bleeding hypothesis, AV fistula, arteriovenous fistula, severe peripheral vascular diseases and absence of arterial pulse and infection over site. Bleeding diathesia means hypocoagulability and arteriovenous fistula means connecting the artery or vein, usually in dialysis. Allen's test has positive polar or negative polar when occlude artery. These are the indications of ABC. Next is components of arterial blood gas. What are the compounds? pH means acid or base, decreased or increased pH, partial carbon dioxide, partial oxygen, bicarbonate and oxygen saturation and base excesses. These are the components of arterial blood gas. Next, coming to the choice of site. First choice is radial artery. This is the most common site and smaller size and easily accessible, and it can be compressed to control the bleeding and to decrease the risk of occlusion. And next one is femoral artery and brachial artery. These are the choice of site: radial artery, femoral artery and brachial artery. Next one is a sample collection. How to collect the sample? Proper blood sample for ABG analysis. It consists of 2 to 3 ml arterial specimen collected anaerobically from a peripheral artery. For ABG we are collecting the arterial sample collection, and ideally radial artery in a heparin rinsed syringe, and glass syringes should be used as gas exchange is likely to occur with plastic syringes. Air bubbles introduced during sampling must be promptly evacuated, and given the local anesthesia, it should be used during sample collection. And if repeated analysis is required, use a different site or insert a arterial line. Next, coming to the procedure. Holding the syringe and needle like a dot, use the index finger to locate the pulse and insert the needle at 45 degrees angle, approximately 1 centimeter distal to the index finger. Advance the needle till a blood flashback appears, then allow the syringe to fill the appropriate level, and withdraw the needle and syringe and immediately close or recap the needle to prevent the entry, and apply film pressure for sufficient time to stop the bleeding. In hypertensive patients or who are taking anticoagulants, bleeding may be prolonged for more than 5 minutes. Transport the sample immediately to the laboratory, and it should be analyzed within 10 minutes for accurate results. This is the procedure. Next, coming to the complications. What are the complications for arterial blood gas analysis? Excessive bleeding or hematoma at the puncture site, and vasovagal attack, nerve damage and infection at the puncture site, and drop in blood pressure, sweating or pallor that may precede lot of consciences. These are the complications. First one is excessive bleeding or hematoma at puncture site and nerve damage, infection at the puncture site. And this is the arterial blood gas analyzer, and parts of blood gas analyzers are, this is the sample wash rinse, and these are the standards are calibrators, and this is the rinse tube and basting, and these are the sensors electrode. You can observe here, this is the partial oxygen, partial carbon dioxide, pH and sodium and chloride. These are the sensor electrodes, and this is the CPU to take the printout, and this is the amplification unit. Next, procedure for ABC analysis. First, mix the heparinized sample gently to avoid the air bubbles in the syringe. If sample is clotted, to avoid the test, and check the machine is ready for measurement of oxygen, carbon dioxide and pH should be active, and press the machine syringe button and push the sample slowly into the probe of machine till beep sound is heard, and remove the syringe. After hear the beep sound, remove the syringe and wait for printout of report. This is the procedure for ABC analysis, and these are the ABC report from instrument. And normal blood gas values are in arterial, venous or capillary. pH is 7.35 to 7.45 in arterial, and venous blood pH is 7.31 to 7.41, and capillary pH is 7.35 to 7.45. Partial oxygen is in arterial 75 to 100 mmHg, in venous 36 to 42 mmHg, and capillary partial oxygen is less than arterial blood, and partial carbon dioxide in arterial 35 to 45, and venous 45 to 50, and capillary blood partial carbon dioxide is 35 to 45 mmHg, and bicarbonate is 22 to 26, in venous 22 to 26, and capillary also same 22 to 26. And base axis, next one is saturated oxygen. Arterial and capillary is similar, some values, some analytes pH and partial carbon dioxide and bicarbonate. These are the normal blood gas values. Next is interpretations of ABC results. pH increased or decreased, that is acidosis or alkalosis, and respiratory acidosis or metabolic acidosis or alkalosis, and stage of compensation and simple or mixed disorders, and oxygen status. These are the interpretations of ABC results. Next is the disturbances of acid-base balance with compensatory mechanism. First one is respiratory acidosis. pH is decreased and partial carbon dioxide increased. That is the primary change. And compensatory mechanism is bicarbonate is increased in renal. Next is metabolic acidosis. Primary changes decrease the pH and bicarbonate is decreased. So respiratory metabolic acidosis is compensated by decreased partial carbon dioxide. It leads to hyperventilation. Then respiratory alkalosis is increased pH and decreased partial carbon dioxide. Then compensated by decreased renal bicarbonate reabsorption. Then metabolic acidosis, metabolic alkalosis increase the pH and increase the bicarbonate. And compensatory mechanism is increased partial carbon dioxide leads to hypoventilation. And these are the acid base disturbances with compensatory mechanisms. And these are the questions. Long essay is various mechanisms of regulation of pH, and second long essay is blood gas analysis, its clinical significance. Short essays and short answers.